Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello there, and welcome to this podcast episode. We are tackling yet another muscle that we can use our neuromodulator for on the face. And so today we are tackling the temporalis muscle. Over the last 10 weeks or so, I have been going on a journey from the top to the bottom of the face with regards to the muscles that we most commonly use neuromodulator on. And when I say neuromodulator, the most famous brand is Botox, but there are other brands that we use as well. Nuceiva, Dysport, Xeomin. They're all neuromodulators and they all help to relax the muscles. And so you'll hear me use the term neuromodulator. I may use some of the brand names. In any case, we're talking about the same thing. Like I said, over the last 10 weeks or so, we have spoken about the frontalis muscle, the procerus muscle. The frontalis lifts the forehead up. The procerus and the corrugators make those 11 lines. We talked about the orbicularis oculi, the muscle that causes the crow's feet. And we talked about other muscles as we work our way down the face. Today, we're working a little bit more to the side of the face with the discussion of the temporalis muscle. Now, admittedly, the temporalis muscle is not the most common muscle to use neuromodulator on, but it is useful for two particular reasons. And so I want to talk a little bit about that today, talk a little bit about the anatomy of the temporalis muscle, talk about why we might treat it with neuromodulator and how it works, how I do the treatment, and what you can expect from it. So let's dive right into it. Temporalis muscle, what do we use it for? The two main reasons that we would treat the temporalis muscle are for pain in the jaw, otherwise known as temporomandibular joint pain. This can come from teeth clenching and other reasons. And the second reason that we might treat temporalis is for migraines. This is a very, very common area to treat when it comes to migraines. In fact, it's one of the standard places to treat when it comes to the migraine protocol when you're using neuromodulator to treat it. And so I'll talk a little bit about each one of those indications, each one of those reasons to use it, and how that relates to the anatomy and how I do the treatment. So let's talk a little about the anatomy. The temporalis muscle lives on either side of your forehead. It is quite a large muscle. It fans over a large portion of the temples, temporalis, and then comes down to almost a point, like a fan, gets skinny at the bottom of it, and it attaches deep onto the top of your jawbone, your mandible. When this muscle contracts, it causes you to pull your jaw up, to clench your jaw. In fact, if you go ahead and put your fingers on the sides of your temples and then clench your jaw, as I'm doing right now, you can actually feel the muscle contracting there. And if you're looking in a mirror, you can actually sometimes see the muscle contract too. If I put my fingers on the muscle and I clench my jaw, I can actually see my fingers moving when I'm looking in a mirror. And so this is a strong muscle. Many people struggle with temporomandibular joint pain. They grind their teeth, they clench their jaw. And as I talked about on a recent episode, one of the ways that we can treat that is by treating the masseter muscle, which is the very strong jaw muscle, but it's lower down, more traditionally in the area that you would think of as your jaw. The temporalis, however, is also a very important muscle of mastication, a muscle that helps you to chew your food and helps you to control your jaw. And so, if someone is struggling with pain in their jaw from clenching, from having a very strong bite, then we can treat this muscle, the temporalis, to help relieve that. How does a neuromodulator work? Well, when you inject it, it causes the muscles to relax. This is how neuromodulator works in all of our muscles. It causes the muscle to relax. When the muscle relaxes, it does not contract as much. In the case of aesthetics, that can be very useful because you get less wrinkling of the overlying skin of a muscle that has now been relaxed. In the case of temporomandibular joint pain, you have weakening of that muscle. You get less of that strength. You get less of the clenching of the jaw. You get less pain. That's how it works. And it can be a very, very effective way to do that. There are a couple of different places that we can inject the neuromodulator in when it comes to the temporalis. As I mentioned, it's quite a broad muscle the further higher up you go into the temple and to the side of the head. And so that's why that can be injected in a couple different areas. Now, when it comes to treating migraine, there are some similarities here. we can treat this in the same area. However, what's interesting is there's a little bit of a slight difference in the reason that we're treating that area. In this area, you have a nerve that runs just near that muscle. And when we treat the area for migraine, we are, yes, treating the muscle, but we are also essentially bathing the nerve in that area, and that helps to make migraine pain less severe. And so in that case, we're not only treating the muscle, but we are also getting the nerve in that area. Other aspects of that are very similar. It helps to relax the muscle, and when you relax the muscle, you get less clenching, and sometimes the clenching can be the issue that's creating those migraine headaches. So, in summary, if you've got migraines, if you clench your jaw, then come speak to me. I'm happy to chat with you about if this muscle is appropriate to treat, which other muscles would be appropriate to treat as part of that overall treatment protocol, and that's what we would do. If you came to the clinic, you would see that we would do an assessment. We would look at the strength of the muscle. We would palpate those muscles, and we would determine what is the best dose for you in these areas. It's normally a few units, give or take, depending on how many different injection points we choose to do. The injection points typically are just in front and above the ear in a couple of different areas, directly over the temporalis muscle, and it's very simple. It just takes a few seconds. So that's a little bit about the temporalis muscle. I hope that is helpful to you. As always, again, I encourage you, go back over the last 10 weeks of my episodes, and you will learn a little bit about each of the muscles in the face that we can treat with neuromodulator. And more often than not, we are treating more than one muscle at a time. And so if you come into the clinic and we chat about it, we may decide that, we need to treat 3 or 5 or 7 of these muscles, and then we go from there. With that being said, thank you again for tuning in. As always, it's a pleasure to bring these to you. If you want to get in touch with me, again, my contact information is on my Instagram at Dr. Teri Fisher, DrTerifisher. You can always reach me through my website at drterifisher.com or at antiagingvancouver.com. And it's been a lot of fun putting out my new Art of Aesthetics campaign on Instagram, where I'm putting pieces of art that are essentially before and after pictures of patients, but we have come up with some titles for each one of these pieces of art, and you can see what I mean if you go and check out my Instagram profile. Thanks again for tuning in. Hope you're doing well, and I look forward to speaking with you again next week. Take care.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.